embarrassing thing to talk about. I think women are much more likely to talk about it to their friends than men. But 49% of gym exercising women experience stress urinary incontinence. And there's also a statistic that 50% of female adolescents. So these are women who haven't had babies, haven't gone through menopause, and they're still having incontinence with physical activity, so like in athletics. So we're talking about a huge population of people. Urinary incontinence is the #1 reason for long-term care admittance. So that's also another huge thing that if we can address this early and get on top of it, it can be much beneficial for really anyone in going into a nursing home and just delaying that. Well, here's the 48% of females. And then urinary incontinence after a prostatectomy is up to 90%. So that's for men when they have their prostate removed after prostate cancer. So for speaking to a room full of ladies, that's apply to you, but I'm sure you all have a significant other or men in your life. So and then this last one is just, it gives a list of exercises that are really common to have leakage with. So it doesn't necessarily mean that these exercises are bad, but a lot of people will experience leakage with it. So jump roping is a huge one, trampoline. I think a lot of postpartum moms can relate to box jumps, weightlifting like deadlift. So all of these things are really common. So we're seeing statistics like 40% people leak with jump roping, 20% with running, those kinds of things.
So we've already touched on this one a little bit, but second myth is only women have a pelvic floor. No, all of us have pelvic floors. Any gender can have issues in their pelvic floor because we all have pelvic floors. Sometimes this comes up because some of these issues can be exacerbated by like pregnancy and in the postpartum period. And sometimes some of these issues will come up with menopause. So we hear about pelvic floors and pelvic floor issues more when we're talking about women, but everybody has a pelvic floor, and it's important for all populations to know the anatomy there, be educated about their bodies, and really be strengthening this area.
Okay, so our third myth, just doing KeGos helps with incontinence. So how many people have heard this one? I feel like just do KeGos and you'll be fine. But your pelvic floor is a muscle, just like any other muscle in your body, and it needs range of motion. So if you don't have range of motion, you can't necessarily build strength. So I'm going to use my bicep as an example. If my bicep is really tight, so it's in a very contracted position, I'm not going to get much range of motion, and I can't put much force output with this. There's not much weight. If I lengthen out that muscle, I can lift a lot more weight if I can move it through that range of motion. So sometimes it's not necessarily a strength issue. It's more so it could be a range of motion issue. It also could be a coordination issue where you're not able to coordinate well. So KeGos can help, yes, and they can help if you're having more of a strength issue in your pelvic floor. An internal exam can help determine whether it's a range of motion issue, if it's a strength issue or a coordination issue. But doing KeGos all day long is kind of like doing bicep curls without weight too. Or you might be doing KeGos in this range too. So you're really tight and tense and not getting too much benefit from that. So KeGos aren't necessarily exactly what we prescribe every time when somebody has incontinence. Okay, and then exercises for strengthening your pelvic floor. So this is a study where they took an electrode and they put it in women's pelvic floors to see how much muscle activation they had in the pelvic floor. So this is measuring muscle activity. They had the women do a Kegel lying down with nothing, measuring how much muscle activity there was. Then they had them do lunges, squats, bridges, hovering, some cat cows, things like that. So these are all core and hip exercises. And what they found is that the pelvic floor contracted 20 to 56% more, I think, than just doing a Kegel alone. So for example, the lunge was 42% more pelvic floor contraction than doing a Kegel alone. So this is why we use a lot of hip and core strengthening as well to help strengthen our pelvic floor as a function and make it more functional for life.
Okay, myth number 4 is that incontinence or leaking is a normal part of aging. And this comes because these symptoms can be very common as we age, but they're not a normal part of aging. It's not something that is definitely going to happen. You can even start the process of strengthening your pelvic floor very late in life and start getting stronger than you were 10 years ago. So it's all about the fact that as we age, it is more difficult for our bodies to build muscle. So we just need to be more direct and more precise about building muscle, but we can do a lot to reduce these symptoms. A few things, as Caitlin was just talking about, sometimes it is a range of motion issue. So if like hips are getting tight or that sort of thing, that can feed into our pelvic floor. So addressing any range of motion issues is going to do a lot for helping with leakage. Sometimes it's a matter of taking some of the pressure off of the pelvic floor. And we can do that in a few ways. A great way to do that is by strengthening everything around it so that there's lots of help for that area. And the pelvic floor doesn't have to do all of these roles of stabilizing and keeping us continent and all of that without help from the areas around. And then improving coordination of those muscles. Sometimes we see that people are told to engage those muscles and they can't see what's happening. So they're actually like doing something that they think is a Kegel, but they're just squeezing their glute muscles or something like that. So that's a big thing that we teach, especially kind of first day you come in, is like, okay, if you try to engage those muscles, what happens? Are you actually engaging them? Do we need to key into that and work on that coordination a bit?
Okay. It's normal to leak while jumping after having kids. I kind of already touched on this, but it's common, but not necessarily normal. So it is possible to have 5 kids and still go to the trampoline park and have fun and not feel like crossing your legs. So there's a lot of things we do in pelvic floor PT to help progress jumping. Usually it's starting with strength training, but we're really trying to strengthen your pelvic floor so that it can withstand the impact of the jumping. So that every time you're jumping, your pelvic floor is creating that stability so that the impact isn't overcoming the bladder and your leakage.
All right, myth 6, having pain with sex, just drink a glass of wine. So this is something we see when we search things online, or we hear that people have been told when they come in with any kind of pain with sex. And the idea that the pain is just coming from you not being able to relax enough is just very much oversimplifying what this is. So it is important for those muscles to be able to relax and move, but that can be a complicated thing that has to do with if there's any kind of restrictions in any muscles that aren't allowing movement in there. Is there a nervous system response from anything, whether it be some sort of trauma or some sort of injury? Maybe you hit your tailbone once and now your body guards that area. So it's something that we have to work on from a lot of different areas and really holistically. And so the idea of just telling someone to try to relax is not super helpful. So some of the things we do tell people to do is we do work on some relaxation techniques, but in a way that is actually practical. So ways that you can get your whole nervous system to calm. We call a lot of these like down training techniques where we're getting any kind of increase in nervous system reactions to reduce. And some of those can be things you've heard of before, like some yoga based and some meditation based things. If those work for you, some forms of visualization can be helpful. But we also talk about breathing techniques because we have that canister and it's topped by our diaphragm. So we can get a lot of benefit from just keying into how our breath works and how it creates a movement in our pelvic floor to help us out, and how breathing in different areas of our body affects our nervous system. We tend to breathe one way when we're stressed and breathe one way when we're calm. The body is not always great at cause and effect. So sometimes if we breathe the calm way, we can convince our nervous system to work in that calmer area. So there's a lot of ways to attack it. And then we also do some more direct interventions here, whether it's releases of deep hip muscles or releases of pelvic floor muscles, or working with tools like dilators to work on getting the muscles used to accommodating and making space.
Myth 7, I pee frequently because I have a small bladder. So I get this one a lot as well. So our bladder has 2 thresholds. When you reach that first threshold in a normal functioning bladder, it should be at about 75% full. So we'll say like right here on the bladder. When that threshold is reached, your bladder will send a signal to your brain saying, hey, it's time to go to the bathroom. Your brain says, I'm really busy, I'm cooking, and people are coming over in 15 minutes, I have no time to go to the bathroom. So brain tells pelvic floor, hey, we really need to turn on, and kind of dampens that signal to the bladder, and you can continue on with cooking. Then maybe a half hour later, things have come down a little bit. You're getting closer to that second threshold, which is that 90% full. Then bladder sending a signal to the brain saying, hey, we really need to go to the bathroom. And these are excitatory signals. Brain says, okay, we need to find a bathroom. Now those thresholds we can retrain them if we are emptying our bladder too frequently. So if we're emptying our bladder when it's 50% full, 25% full, frequently and often, then the brain's gonna get used to, oh, I'm at 25% full, I need to go to the bathroom. And then that second threshold, if we're always obeying that first signal, might be 2 minutes later, might be 30 seconds later, where you feel like you get that urge and then you can't hold it. You just have to go as soon as you get it. These are also excitatory signals sent to your brain. So it's exciting your nervous system. So things we can do to help calm down our nervous system when we get that extreme urge to go is doing some deep breathing, trying to find some distraction techniques. This one's the hardest for everybody, but walking slowly to the bathroom. So rather than running quickly to the bathroom, trying to pull down your pants quick, all of those things, trying to calm everything down. We want to bring in the more inhibitory nervous system versus that excitatory response. Other things we can do for like training the bladder is just avoiding going just in case. So you might get the urge every time you leave the house because you always go to the bathroom before you leave. Or as soon as your key gets in that door, you will have to run to the bathroom because your brain has been trained. Every time I do that, I go to the bathroom after. Or cold breeze can be a trigger, running water, especially like potty training. All of those things can be triggers for urgency.
What is JIC?
JIC is just in case, so avoiding just in case, yeah.
We see it often enough that we've created a shortened version of it. All right, myth 8, lifting will make my bladder or insides fall out. So this is associated with something that's called pelvic organ prolapse. So first kind of myth within here is that pelvic organ prolapse doesn't mean that your organs are gonna fall out. So what it is that it's kind of a loss of either structural or muscular, often both, stability in the pelvic floor and the pelvic girdle. So it just means that there's some weakening allowing travel of that support system that we talked about that has the bladder, uterus, and rectum there. So some of that can cause some laxity in either the vaginal or rectal wall that allows things to move. So the best thing we can do for that is to up the stability in that area by strengthening. So we've seen from studies that people who are actually regularly strengthening more, even to the point of women who are lifting more than 100 pounds regularly in the gym, we're having 3 times less symptoms of this prolapsing than people who are avoiding lifting and we're trying to never lift more than 30 pounds. Because if you're lifting intentionally with good form and good guidance, you're strengthening all these support systems so that we're having that stability and we're counteracting any weakening or looseness that we're getting there.
Okay, number 9, you shouldn't exercise during pregnancy. So this is getting better and better, and we're getting a lot more research on this, which is great. But for so many years, it's been unethical to do any studies on a pregnant woman. So what they're doing now is they're doing like retrospective studies on women who are like, I don't care what you say, I'm still gonna work out. And so for a while, like they would say, don't lift over 40 pounds or don't get your heart rate over 140. So those have pretty much been debunked because women who still are doing all of those things have had good pregnancies. There's no increased risk of miscarriage. And even they're coming out with most likely better labor and delivery outcomes as well. Also, it can be so good we all know that exercise helps with high blood pressure. And preeclampsia is high blood pressure in pregnancy, and that is typically recommended to be on bed rest. So if it's severe preeclampsia, then yes, we need to be on bed rest. But like, what a better time to be exercising to decrease that risk. Same thing with gestational diabetes. We know that exercise decreases our blood sugar. So exercising can help reduce the risk of gestational diabetes, we now know. So just so many good things and benefits to exercising during pregnancy. So this is just some kind of like red light, green light things of like if you should be exercising and like when like don't exercise while you're pregnant. So some absolute contraindications would be persistent vaginal bleeding, a ruptured cervix, you have triplets, severe preeclampsia, placenta previa after 28 weeks, and then an uncontrolled thyroid. Relative contraindications would be recurrent pregnancy loss, so you're having multiple miscarriages in a row. We just don't have research on it, so just to be safe, not exercising. History of an eating disorder or history of preterm birth can also be yellow lights.
All right, myth number 10, you need to strain to have a bowel movement. So this one gets a little bit nuanced, but it's really important because when we're doing a lot of straining, we can put a lot of pressure on our pelvic floor. And having bowel movements is a part of life. We do it over and over again throughout our lives. So if we're always putting a lot of pressure into that system over and over throughout our life, it can be one of those things that leads to some dysfunctions in the pelvic floor for women and for men. So we want to reduce that as much as possible. Also, often when we're talking about true straining, it's when people are like bearing down, holding their breath. And that's when you start to hear about people like passing out while they're trying to use the bathroom. We don't want that. We want to keep blood flow and oxygen to our brains. So bearing down is slightly different than straining. When we're talking about bearing down, we're talking about creating even pressure throughout our abdominal cavity to encourage movement in our bowels. We're not holding our breath with it. So some cues that we often give, one of them is called big belly, hard belly. So you're creating some force through your abdomen to create even pressure and not just squishing down. One of my favorite little tricks to create some pressure without straining is blowing into a closed fist. So if you close your fist and you blow into it like a bad trumpet player so that your like cheeks are puffing out, you're creating some back pressure into your system while still letting air escape and you're not building pressure in your head. So we can create some pressure and bear down without just smushing and holding our breath and straining. And also some things to help decrease the need for creating as much pressure is just getting into an optimal position when we're trying to have a bowel movement. So we tend to have very like upright toilets, especially in the Western world. They're kind of like our chairs, but our pelvic floor is not really designed for opening and voiding in that position. Partially because that's kind of the position we're in when we're standing up and we don't want to be losing our bowel movements then. So we have a muscle that kind of kinks off our rectum. And when we're able to get into something closer to a squatting position, it opens that channel up more. So not many of us are truly squatting to use the bathroom. So there are many tools we have now. The kind of first and most like popular one is called a squatty potty. But there's tons of ones you can use. There's like usually like baby like step stools that you have if you have kids or grandchildren that they use to just reach the toilet. Those can be helpful. But that's getting your knees above your hips. So mimicking that squatting position to create that open channel in our pelvic floor. So it doesn't have to be really dramatic, but just getting that positioning better. Now you have an open channel and you don't need to create as much force because it's just gonna be much easier to relax and open the pelvic floor. And managing your pressures by building those pressures well and by keeping everything nice and relaxed in the pelvic floor. We can do that with positioning and sometimes putting like elbows underneath so you're not holding yourself up and using your muscles while you're trying to let the muscles react. So that's important too, because sometimes when we're straining, we're just trying to put as much effort in as we can. And we've talked about how contracting is closure in the pelvic floor. That's those sphincters closing. So if we're just trying to put as much effort as we can, we're probably engaging those sphincters and closing, and then we're trying to push through a closed door. So we want to keep things open with good positioning, use techniques like our big belly, hard belly, or blowing into your fist to create pressure, and then make sure that we have really good consistency in our bowel movements so that it doesn't require as much pressure as well. And that comes from what you're taking in is going to decide what's coming out. So having great fluid intake, most of us are not drinking enough hydrating fluids throughout the day, and getting fluid into the bowels is going to help with just the motility and also with the consistency of our bowel movement. And then getting the right distribution and the right ratios of fiber in our diet is really important for having the right consistency there. And then those are our 10 myths that we're going over today. So we want to open it up for any and all questions that you have.
Or things you came that you wanted to know about that you didn't hear about. We did a really broad scope of everything, kind of.
Okay, so when you're solid waste, sometimes it floats and sometimes it drops. So what's why?
Sometimes that can have to do with fat content
Okay,
and what you're eating. So if it's not causing any like pain or issues, it's not a huge deal, but it's worth kind of tracking what things are causing what, and see if maybe some days you're taking in
too much
more fats
sugar.
and that sort of thing.
I have one. Who, do you guys do the internal exam? You
Yeah.
do.
Yeah.
What is it like?
So that's a great question. So the closest I could compare it to would be OBGYN, but it's not really the same. Because we're not using any speculums, we're not using any stirrups. You're just on a treatment table in a very comfortable position in a private room, have a gown draped over you. And then there's different kinds of internals we can do. Most common would be vaginally. So that would be one gloved, lubricated finger in the vaginal canal, checking all those muscles that we talked about, seeing if we're having any restrictions in any of those muscles. Just like any other muscle in the body, you can get knots in your pelvic floor. And that's something we can help with and do some release if that's something that's blocking that range of motion that we talked about being so important. And we can also check on your coordination to see if there's something missing in like how you're doing those contractions, or if it's uneven, if it's not happening as strong as we want it to, and we can track that. And then we can also check for if there's more movement than we like to see and we need more stability there. And often if we're doing any kind of internal assessments or treatments, first of all, that's always up to whoever's coming in. It's not by any means a like end all be all part of pelvic orthopedy. We talked about all the things we can do in the gym and all of that. So it's never, I always want to assure people that if they're not comfortable with it, we can find lots of other things to do. But it is a great tool and it does give us a lot of information, and there's a lot of great treatment techniques that we can do there. And we also like to check for if we notice anything off with any of the actual tissue, like if we're noticing any changes that might need more hydration or anything like that. We also like to check on those so that you can have a conversation with us or have a conversation with your provider about those as well.
So what kind of exercises do people do?
Yeah.
So some of them are coordinating your pelvic floor with movement. So let's say we'll take a squat. If I'm squatting, I'm gonna contract or like do a Kegel here and then come up with movement.
Oh.
Sometimes it's just working on core activation. It's working on hips. We do deadlifting, we do like tail off presses, and it depends on the person's function too and what their goals are. So it can be anywhere from table exercises to jumping and doing more heavy weightlifting.
So we'll do that. I mean, you would do that. I mean, that's what you do.
Mhm.
Yeah.
Yeah, and so sometimes like, and I see a lot of athletes too, and they're strong people, but we'll look for certain muscle groups that may end up like where they're deficient in. So maybe their hip abductors are weak, but the rest of them is strong kind of thing. So because of that, maybe in the frontal plane, they're having some pelvic, some leakage or something like that.
Can you tell us about the importance of having exercise within the gym paired with internal work and the impact that that makes?
Yeah. Well, We like to make sure that we're doing stuff that's actually gonna translate to functioning you're doing throughout the day. So as important as it is to do like isolated movements in the pelvic floor, we're rarely doing isolated movements in the pelvic floor throughout the day when we're lifting groceries or getting in and out of a car or playing pickleball or playing soccer or whatever it is that the person who's coming up to us wants to do. So we want to make sure that we're fully preparing people for what they have to do because the pelvic floor is so connected and integrated with the rest of our body. If we're lacking strength there and we just focus on isolated strength and they're doing good and then they get back to their favorite activities and have issues again, it means we missed something in kind of the progression of making sure that they're actually functionally working on things as a whole.
So how long does well, of course, it's everybody's an individual. I mean, does it take months, weeks, days? Depends on the person, right?
It very much depends. There's sometimes I see patients and they just need a lot of education and it'll take a couple visits.
Mhm.
And then other times it's months. It just depends. Yeah.
Well, general lifting, is that sort of good for you? I mean, for you, yeah.
Yep.
Mhm.
And it's good for so many things. Good for our pelvic floor, so it's also great for our bone density and for our cardiovascular health.
So you would be doing some of those with weights, yeah.
Yeah, for sure. We've got a very well stocked weight rack. We use most of them.
And a lot of times too, like we're working on increasing range of motion first and then working into strength. Because if you don't have the range, then we can't build.
I don't really get that range. How much range do you need?
So your pelvic floor moves like this throughout the day.
Oh, really?
And so when you're bearing down, we like to think of your pelvic floor as an A-frame house. So
Okay.
you have your attic, your main level, and your basement. You do most of your living in that main level. So your pelvic floor is kind of at maybe slightly contracted to help, support, but not doing a ton of movement. We go down to the basement when we're bearing down, having a bowel movement. And then it contracts, lifts up when we're lifting, pushing something heavy, and where it needs to create more support for your
I
system.
would think rowing would be a good one for the pelvic. You know?
Oh, yeah, rowing's a great
Yeah.
exercise for your
Yeah.
pelvic floor, yeah.
Bicycling?
Yeah.
Mhm.
Honestly, there's not much, because it's part of that deep core and, really the base of stability for your whole core, and core is like this canister versus just your 6-pack abs, like. Because of that, any movement, any function, your pelvic floor is gonna be engaged in some way.
And jumping.
Yes, a lot, so jumping.
Anything else you're done?
How about swimming? That's so much fun. That probably doesn't do much.
It does, I mean, that's full body, you're getting a really good core activity.
For your whole body,
Yeah.
your back, everything, but I don't know about your pelvic area. Not if you're kicking.
You're not, so the swimming's great because if you're having issues with leakage with exercise, you're in a horizontal position, so you don't have gravity on your pelvic floor. However, it's still activating because you have a lot of core activation in swimming.
So if I said, oh, well, I don't have any problem with any exercise having leakage, but I sometimes, need to get to the bathroom fast.
So that's more so the urgency. So that's gonna be more so learning to relax your pelvic floor, more so than strengthening.
When it happens, but then I read that you're not supposed to, do that too much.
Right. So, and sometimes there's a lot of patients who have come to me and they say, I'm doing 100 KeGos a day or whatever. And I say, stop doing KeGos like altogether. Or they're not doing KeGos at all, but I never prescribe KeGos whatsoever because we need to work more so on relaxation.
But sometimes I read that you're not supposed to hold it back too long, too often.
Oh, yeah, so normal bladder voiding is between 2 to 4 hours.
Oh,
So if you're getting to that point of like somewhere within there, then you're fine. If you're urinating every 30 minutes, every hour, then you're not even getting your bladder full. It's your thresholds that we talked about are lower. So, you can push it out and use some urge suppression and relaxation techniques to help increase your bladder capacity. You're not getting anywhere to the point of like getting a UTI. That's holding it like 6, 8,
okay,
9 hours.
yeah, so a lot of water is good so you don't get UTI.
Yeah.
Yeah.
And
So
actually,
there's all these.
yes, and a lot of people are gonna decrease fluid intake when they start leaking, right?
Mhm.
But it's actually it irritates your bladder more if you have less water in your bladder. So if your urine is really concentrated, then it's gonna be irritating to your bladder and it's gonna wanna expel it faster. You're gonna have increased urgency and potentially increased leakage.
If you don't drink enough,
Yes.
okay, and we all know about the colors of urine too, don't we?
Yeah.
Yep, do we?
Like darker urine's gonna be that you're not
Right.
hydrated, and then if you're, clear, lighter, then you're good.
But what about clear though? Is clear really good? I mean, yellow, a little bit yellow is better, isn't it? Than clear. I mean, you tell me, I don't know.
I mean, you're not gonna go wrong if you're clear. You're not gonna be in a bad, like, if
I'm
you're drinking over gallons of water, it's okay, but.
If you're hydrating frequently and drinking as much as we know we should, should we not, very few people actually reach that. Does that change that sort of signal in the bladder? So like, if you've had 2 huge, containers of, fluid, if you're working out or something. Theoretically, your volume obviously goes up, right? So will that trigger at a different point, or should you still be able to hold it a couple of hours?
So it's gonna depend, most of the norms we have are for like an average of population, so everybody's gonna fall somewhere in there. So it is gonna depend on your bladder capacity, how much water you're drinking and how short of amount of time it's in. So usually your threshold's gonna hit at a certain like amount of milliliters. So if you hit that number of milliliters really quickly, maybe you'll use the bathroom a little bit earlier than that window because you took in a lot of fluids, or you took in something like caffeine or alcohol that's a diuretic and clear those fluids to your bladder faster. So you might have to go sooner. But that also takes into account if you're at the gym taking in fluids, you're also sweating out fluid.
Right.
So not all of those fluids are reaching your bladder. So there is some variation there depending on what you're taking in, when you're taking it in, and what other activity, what temperature it is,
Right.
that sort of stuff.
Okay. Yeah, and as a general rule, probably you wanna as a rule, you wanna try to hit that to, if you're having struggles, you wanna try to get your bladder to, up to that 90%, 75 to 90% threshold. But in cases where you might be drinking a lot of water, it's acceptable to go more frequently. It's just that as an average through the day, you kind of want to have that. Okay.
It's just annoying to go to the bathroom, right? I mean, it's not really unhealthy, is it?
No,
No.
well, so I'm gonna get both those things. So there's a study that had tracked people who are drinking half a gallon of water, which is like there's 64 ounces of water. Then they had people doing 100 or a full gallon. They had people who are drinking a full gallon were going to the bathroom 11 times. People who are drinking the half gallon were going 7 times. So it's definitely increasing, the amount of times you're going.
Yeah.
And they were also tracking bladder, like how much the bladder was filling, and they were saying average of 300 milliliters. So, which would bladder, that's like 3/4 of the full. And then, yes, so as far as it's fine to go to the bathroom, we say that 2 to 4 hour mark is average, But if somebody is going to the bathroom every 30 minutes and it doesn't bother them that they're going every 30 minutes, then we say, we're not treating, we're not gonna force that issue on you to have your perfect pelvic floor bladder capacity because it doesn't bother you. But if it's really bothering you that you're going every 30 minutes, then yes, let's change it and address it.
Okay, then there's anxiety. Sometimes when people, are very anxious, or worried about something, they go to the bathroom a lot.
Yep. So that's because, remember how we were talking about when your bladder sends a signal to your brain, it's an excitatory response? That's your fight or flight nervous system. When you're in high stress and anxiety, you're in that fight or flight response even more so. So those urgency signals, your brain, your nervous system's already excited. And so it's just like compiling on top of each other, that excitement of the nervous system, increasing that urgency.
Do we have any questions in like chat or anything?
No questions on the chat.
Feel free to send your questions in.
Do you have any male pelvic floor people?
Oh,
Okay. That can help men for your
I
third
would
section.
say right now, my caseload's 25% male, but there's been times where I've been like 50-50. That's not necessarily the norm, like norm is definitely more female, but I do see a lot of men.
We also have a men's pelvic health workshop in June coming up.
Just for men.
Yep. They'll probably bring their significant other, they're not coming alone.
What are you doing when it's cold? I walk outside,
Yeah.
and I'm like, oh, look at this, I'll walk right back in the house and do whatever.
Yeah.
That's why I've gotten to the, I do before I leave the house, because I know the second I open the door,
The
a
cold
breeze goes by, I'm gonna be in trouble.
So the reason why the cold breeze is an issue is because when you pull down your pants to go to the bathroom, it's kind of like that simulated kind of cold breeze. So now your brain is thinking, oh, it's time to go to the bathroom. So it's just that like learned habitual thing. So couple things is doing some like deep breathing before you go out into the cold, trying to relax and calm down your nervous system. Even doing like a Kegel or two sometimes can help, just like, okay, pelvic floor, we're turning on right now, we're not turning off. And then changing your routine. So this might sound weird, but like in your home, obviously pulling down your pants and then putting them back on without going to the bathroom. So, and just making that more routine so that you're not just training your brain that every time I feel that cold breeze, I go to the bathroom.
I think it's so hard in a way because we're conditioned from the time we're little kids. Oh, hey, everybody go potty before we leave the house. Like if you're getting in the car, because you don't want to love all your children out,
Right.
girls' bathroom somewhere or whatever. And so it just becomes like an innate,
Yeah.
you know,
So,
habitual
Yep, if you
response.
see a bathroom, go.
Yeah, exactly.
so yeah, a lot of these habits start very early.
Yeah.
And so both beneficially and not beneficially, the bladder is actually, we talk about potty training as kids. The bladder is trainable throughout our whole lives. So sometimes that gets in our way because we do train it in ways we don't mean to, like every time we go to Target.
Right.
We go to the bathroom before we start shopping, and then we see a Target, we have to go to the bathroom.
Yeah.
So sometimes it works against us a little bit, but we can use those same things to train it the other way and retrain some of these things so that some of these patterns we built a long time ago, we can start to slowly build new patterns and decrease association. So we're not getting triggered every time we hear that running water that was
Right,
run when
right.
we were trying to learn how to use the bathroom on the potty and that sort of thing.
In terms of temperature of your urine, I mean, sometimes it seems warmer than others.
I would say your body temperature, but I really don't know.
I don't get up in the night, but
Oh,
in the morning, like when I get up, it's like I'm running to the bathroom.
several times.
So sometimes it can be helpful, like at that point, your bladder's full. So like you do need to go to the bathroom. If like when you sit up out of bed, taking some deep breaths to calm down your nervous system. Like, it's really what's happening is urine shifts as you sit up and stand up, and then it's like, oh my gosh, I just need to go. But your bladder isn't gonna overflow because it was fine. So taking some deep breaths, like as your feet hit the floor, just sit there for a minute and then try and walk slowly can help.
Yeah, and then we all know, like, especially with little kids, there's like this whole thing here. That is actually a way of creating some pressure on our perineum area. So that's why kids instinctually do it. So it's kind of partially that as well. Like you sit up, the weight of the bladder kind of hits that area. But then as soon as you stand, you also lose that pressure from your bed.
Right.
And so you lose that pressure that you have there. So letting that pressure be there for a second before you like sit up and run and doing your breaths can help calm that before you stand up and go on your way.
And it is okay.
Yeah, you can still have a fun strategy.
We try to work with you so that you don't eventually have to, but you know, if you have to, you have to, especially the beginning.
It's no fun when you're camping and you have to get out in the middle of the night, you know, find the outlines.
There you go.
It's kind of scary sometimes too.
And that's a good example of like, maybe somebody doesn't mind getting up once a night to use the bathroom or twice a night, or maybe they don't mind getting up 3 times a night. But if they go camping, they don't want to have to do that. So some of what we treat is what is important to the person who's coming into us. So it's not just based on the norms we see in research and things. A lot of these are created because they're what we think of as what's going to allow you to live your life without designing it around your pelvic floor and bladder functioning.
Yeah, and it's fine if you can get right back to sleep. I mean, if you have to get up, it's kind of fun to go right back to sleep.
But if it's interrupting your sleep and you're staying up for a long time.
Yeah, if you can't get back to sleep, that's
That's not fun at all. Yeah.
And for night urination, like for frequency, getting up in the night, usually we change the frequency during the day. If you're going less during the day, we can control that more. Typically, night resolves itself. Because your bladder's used to having more capacity.
And some people don't drink after a certain hour.
Yep, that can help too.
Gosh, we covered a lot of stuff. Talking about this before.
Anything else? Okay. If you wanna, we'll hang out here for a couple more minutes if anybody wants to. It's too embarrassed to ask questions. Everybody's too short.
So what are you gonna do? Are you gonna set up a program for us?
Well, maybe we should talk about that.
Yes, yes. Okay, so if, I don't need to come up there, but I will if you can hear me. So we have all of your emails, so I will just make sure that we send a follow-up email out to you guys so that you can sign up that way. So it'll take you to our website and you can give a call to any one of our 3 offices. We have our Victor, Brighton, and Priest. And then we also will be at the desk tonight. I'll be out front and our care coordinators have left for the night, but I'm happy to take down your name and phone number and they can reach out to you tomorrow to schedule your initial evaluation. So what that looks like is it would just be like your first time coming in, you can just talk with a PT. They can learn more about you and then you can talk about formulating a treatment plan. So nothing crazy, just kind of learning more. And at the time that our care coordinators work with you, they'll take your insurance information and get all of that sorted out. It's very simple, very easy. And we walk you through the whole thing. So if you do want them to reach out to you, I'll be at the desk.
One thing, I think the biggest barrier to coming to pelvic PT is the internal exam. First, I don't think any of us do it on the first day unless the person is like really wanting to do it. And then second, we can use ultrasound to look at your pelvic floor. Symptoms tell us a lot, whether you're having tension or a strength issue. So there's other things that you can do if that's really like bothering you. without the internal exam. Yes, it gives us a lot of info, but we can do other things, and it's usually not your first visit, so you can come in, get a lot of information, and then see if it's like, I wanna do this or not too. So.
What, do we do exercises for an hour when we're here, or what happens here?
Yeah, so, we create a treatment plan that's designed for exactly what you need. Usually the first day is just an evaluation, so we talk and you get a lot of education that's gonna be very specific to you. So like, feeling a cold breeze, you know, like we'll go a little more in depth of that, or, key in the door, or jumping, like very specific education, because today was very broad over a lot of topics, and then,
Key in on the person.
yes, and then the follow-up visits will be more so going into exercise and stuff like that.
Like, is it 2 months, something, what's average, a month ago, 2 months?
So, well, it depends, if it's like, urinary urge incontinence, that's gonna be shorter, so maybe like a month or two-ish, it could be more. And then if it's stress, usually I would say that's like 2 to 3, that's more so like jumping, coughing, sneezing. Sometimes that can be 1 as well. And then constipation, the whole nother, like, there's a lot, yeah, it can go everywhere, but I'd say average, maybe 2 months. Average.
Yeah. Yeah, I think it's kind of anywhere from like 6 weeks to closer to 18.
Yeah.
Something in that range.
And if you don't do your exercises, I mean, even after we leave you guys, it might come back.
Yeah.
So you
So
have
there is some level of, our goal is never to be that, we have to do everything for you. Our goal is to like come alongside you, build something that is doable for you so that you eventually don't need to come anymore and you can take care of things on your own. You are like empowered to be able to figure out what to do if you run into snags, and then know that we're always available if you do need more.
Yeah, okay, great. Good job, guys.
All right, I'm gonna head up this way. Y'all can follow me if you want, and then just stop at the desk if you do wanna, have us reach out to you. Thank you for coming.
Okay.